What's up, you pain reproducers? Welcome back to the second episode of Me and My Friends podcast about physical therapy. In this episode, we go over some productivity tips for PT school. Then we go over our first ever article review in our Placebros segment. And we finally finish by taking some listener questions. Hey guys, welcome back. This is the second episode. You were just introed and now we're here. So is there any opening remarks or anything we want to...
Guys, we have a name.
Do you notice anything different about us?
The funny thing is that the intro now for the last video is going to have that. So it's kind of...
Whatever.
Whatever.
We'll edit it out. Post-production. Jamie, get that.
So anything going on? I'm just climbing over my seat here. Any opening remarks or comments that we want to start with? Anything on your guys' minds before we get into it?
Last week we actually had 0 listeners, 0 viewers. So if you are currently listening, and you've actually never done anything, taken first in anything, congratulations, you're now our first listener.
We'll send you a plaque.
Yeah.
Well, it's actually the Bacon Chocolate Chip Pancake Award.
Yes.
So if you send us your address, we'll send you 1 bacon chocolate chip pancake from the famous Queen City in Reading, Pennsylvania.
Maple syrup is not included.
No, get your
We
own.
can't afford that.
Yeah.
Get your own.
Should we tell the story about that?
I think that'd be great.
Yeah.
I think we're going to address it a couple times.
Yeah, I'm sure it'll be addressed countless times, but
people are going to wonder why we look so Canadian, so
that's true.
we should probably address it now.
Yeah. And we do love our bacon chocolate chip pancakes, which basically started, I guess it was the fall semester of our first year, right? First ever semester.
Yeah, it was at the end.
We were out one night and...
getting loose, partying it up a little bit.
Partying it up.
First time to relax with everyone.
Back when we thought PT school was going to be fun and we were actually going out and drinking. Now we just drink to drown our sorrows. That was fun drinking. And so we were at Queen City Diner, which is right down the street from our school.
They're actually one of our sponsors now. Thanks, Queen City.
Queen City will be right here.
And I was fairly inebriated at that point in the night. And on their menu, I saw banana chocolate chip pancakes. And what came out when I attempted to order those was bacon chocolate chip pancakes. And apparently the waitress asked if I was sure I wanted that. I said I was.
The story is Chris actually gave her an attitude. Of course I fucking want.
So then it's kind of become a tradition since then. Every time we go out, we've got to finish the night with Queen City and some bacon chocolate chip pancakes. So that's our award for you being a listener.
It's our fourth macro.
Yeah, that's the 4th macro. Bacon chip.
I don't eat carbs when I do.
Chocolate chip pancakes.
It's not a carb.
Anything about last week's episode that we want to clear up, or do you guys remember anything?
I actually haven't listened to it, so I don't remember
Yeah.
what we actually said. But when I do get around to listening to it, then...
I'm sure it was great. It was perfect.
Yeah, it was probably great.
Awesome.
No changes.
I actually do remember I said I thought about this after we recorded.
It's been haunting you ever since.
Yeah, actually, it has been affecting me a little bit. I said something about when I was thinking about going to school and not wanting to do massage therapy because I didn't want to massage gross people. It wasn't necessarily the people working with the patients, but just from knowing what goes on and what you see in hospitals. I just didn't think that was
so you
what
think
I
people
wanted
in
to
hospitals?
Thanks for clarifying that.
So
Okay,
I
thanks,
felt
dude.
bad about that, but
Chris Starr's inpatient PT.
that's a ringing endorsement for me as an inpatient physical therapist.
Don't ever apply to a hospital, dude.
Yeah, and I don't know shit about massage therapy, so sorry if I offend any massage therapists.
We just said that it's a placebo, but besides
no ill will. Don't. I mean, when you start talking on camera, you just never
Say
know
whatever,
what's.
man.
You don't think about these
Easy
things
peasy.
until after. Yeah. But so should we get into our
Let's get
first
into it.
segment? So
Let's get into it.
we decided that first up this week we are going to talk about productivity tips for PT school, just I guess in general.
Yeah.
So I don't know
And I
if
think we
there's
kind of
anything-
covered some of those
Yeah.
things last week.
Yeah, it did
But I
tie
think
in
we
a
could
little bit.
clarify or like get into more of the details of what we personally do and like what our
Yeah.
routines are to stay
Got a
productive?
couple notes for,
You want to get
for
started?
productivity. Well, I think it starts with like mindset. I mean, I think
Absolutely.
like in my opinion, there's so many avenues you can go into in physical therapy that you almost should approach it like your first semester in school. It should be like, what do I want to become as a therapist? And you structure your entire like 3 years getting you closer towards that. So I think number one is just like, again, the mindset of what do you want to get out of school and what do you want to get out of like your career. And you have 3 years to basically get a head start on that, whatever that answer is for you. So that was a thought of mine, just to get started with. And then I think based off of that, so a little Jordan Peterson for you.
JP.
So big fan of Jordan Peterson, but so I've heard him on a
I'll be here one
podcast.
day.
Yeah,
We just
one
lost
day.
all our left wing fans.
But I think more so like the psychological aspect of some of the stuff he talks about. And one of the interviews I heard with him was talking about his future authoring program. I don't know if you guys are familiar with anything about that with him. But anyway, so he has this thing that he offers as a service for people to do on their own online, but also something, he's a psychology professor up in a university in Canada. Shout out Canada. Hey there. So he had run through this with some students as well,
Sponsored
and
by Canada.
the entire country. So what his idea is with this future authoring program is it's a basically essay you write detailing out. So he did it with students in his class, basically the best that your life could turn out over a 5-year period, and like what you would do to get there, what your daily routine would be like.
Cool.
Yeah, but then also in 5 years, what could the worst you possibly like be in terms of your situation in life, and what would you do to have gotten there? Like, what bad decisions would you have made along the way? Basically mapping out both the good and the bad, which I thought was a really cool perspective on it. And I think he makes a pretty good point in that, like, negative consequences can be a really big motivating factor for people. So I think that's another thing in terms of like not only you as a student in physical therapy, but also just again in terms of career, like where could you be like if things turn out as best as possible in 3 years, and where could you be in 3 years if you really made some bad decisions along the way? So you can kind of see that in real time, like where you could be heading. And it's not a surprise then when you end up at either one of those places. So.
Yeah, I think he even gave examples of students that he done that with in the past, and like students that organized themselves both found themselves to be in like much better situations.
Yeah.
There's like clearly evidence that doing something as simple as like even just mapping out what could go well and what couldn't.
Right.
Like just
writing it down.
Prosper.
Yeah, exactly. So that was just kind of my thought, like number one thing overall is just your mindset leading to, what you're going to end up doing.
It's like your foundation.
Yeah.
It's not a good mindset. Anything else you do kind of goes to shit.
Yeah.
I think we talked a lot about this last week too. It's just like setting a schedule. I know you had touched on like waking up early, then you do your stuff. I like talked about my no, I was like segueing you into it. I talked about like doing an 8-hour day type thing, like including class 4 hours and class 4 hours, like spending out of class. It'll help organize it. And it also helps you like get into work mode, if you want to say that. When you do graduate and then eventually you're working an 8-hour day or maybe like 4 10-hour days, just like getting your body in the right state of mind so you're able to wake up that early, you're able to like perform at an earlier time, and then like your body's just used to working till like 4 or 5 and then having the ability to not be so tired, not eating shitty foods at the end, and then you're just going to wake up feeling better. So that's like the first start along with the mindset, I think. But talk about your waking up.
So I mean, my schedule isn't necessarily for everyone. You kind of have to like experiment with it. I know like I was a personal trainer, so I was used to waking up early. But before that, like when I was in undergrad, like that's when I started training. But before that, like I thought of myself as like definitely not a morning person. I hated the mornings. I hated getting up and stuff. But 5:30 to like 9 o'clock is where your money's made in the mornings training people. So I just got used to it. But then I actually got out of the habit when I first started school. And then like once I got back into the habit, like my productivity definitely increased. So what I do is I'm very unproductive at night. I just don't like doing stuff. I just like chilling. So I'll wake up usually around 4:30. So I'll go to bed at like 9, wake up at 4:30. I try to get at least 7.5 hours of sleep every night because sleep's probably going to be your biggest factor. If you're not sleeping, your day's going to go to shit. You're not going to want to do anything.
You and Jocko Willink are up.
Yeah, me and Jocko, we actually texted them. Hey, you up?
You up?
So I'll wake up at 4:30. I'll go downstairs, make myself a cup of coffee, and I'll come up with butter, of course.
Of course.
Kerrygold.
Butter sponsor.
Board's gonna be filled.
And I go back. I go back up with my cup of coffee, and I'll sit there for like an hour and a half, and study or like just do work for school. And most of the time it's fairly productive. Sometimes you're still tired, and you don't feel like doing shit, so you end up watching YouTube videos or something. But I'd say the majority of my time, I actually get work done. And along with that, so I set a timer for myself when I study. So I'll do like a hit timer online, like an exercise timer, and I'll do like intervals. So I'll do like 25 on, 5 minutes off, and I'll do like at max 4 rounds of that. So I'll do 25 minutes on study, and then I know in my mind like I have 5 minutes of break coming up, and 25 minutes is that long, but like it's kind of motivating you like to not get distracted. You're like, all right, I only have to do this for 25 minutes, and I could take 5 minutes, and like over the 5 minutes I'll do like a mobility break, or like I'll read something or watch something or listen to music for those 5 minutes and get back to it for the 25. And again, like at most I'll do 4 rounds, so that's 2 hours straight of studying, and then I'll take like a longer break, like a 30-hour long break, and over that like I'll eat and do whatever. But I feel like that's been really helping me.
Yeah, I like that idea a lot.
Yeah.
Because I've long maintained that I think a lot of PT students are like OCD to some extent, and I think like the more organized and like structured you can be, and I like that because it ties or like falls into that. Like I know it's like this, sort of interval of studying, then I have this rest.
Plus we had a guest lecture, Dr. Child, the other Dr. Child, our professor's husband, and that was like the first thing he said. He's like, there's research showing that students pay attention for 15 minutes and then lose it, so you might as well take a break, for even if it's like a minute or two after the 15 minutes. And when he said that, I was like, all right, I just have to pay attention for 15 minutes, rather than other lectures where you go on for an hour, hour and a half.
Yeah, you don't know when
focus
you're gonna,
you
don't know when you're going to
10 minutes,
break.
and then you're like, wait, what the hell
and
slide are we on?
And then you end up getting going online and then like get reprimanded for it. Anyways. So along with like the waking up early, if like one of the best things I ever did was to set my alarm or like on my phone and then put my alarm somewhere where I have to get out of bed to turn it off. Because like before I used to have it like right next to my bed, and then like I would like snooze it, or I would set 2 alarms like 5 minutes apart and just like wake up, turn it off, go back to sleep for 5 minutes. Like that's gonna do you any good. And then wake up again. But like now I have to physically get out of bed to turn my alarm off, and then I'm like, all right, I'm already out of bed. I might as well just go brush my teeth.
I wanted to invent something like that, and it's almost like technology is going the other way. It's like when you wake up, like suddenly your coffee maker's on already. You don't have to. You do like the bare minimum.
No incentive to get out.
Yeah, so it's like getting harder and harder, and I want to go that way.
Your
and everyone's
coffee
going
maker
this way.
brings you coffee in your bed.
You got a robot now, and but like I wanted to invent something like your alarm goes off, the lights go on, in like the other room, the music's blasting or something like that. The shower's already on, you might as well like get into it. But like I said, like Alexa's
that's another
here now and making coffee makers smarter and
weird stuff
going the wrong way.
Jocko Willink again. That's like a concept he talks about in Extreme Ownership in his book, which is one of the best books I've ever read, and talks about some of the stuff. But his idea there is like it's your first opportunity to get a win that day. So like the alarm is like your opponent. And if you get up and don't get back in bed, you've won. And that's already
he addresses that a lot,
momentum.
Like with meals and stuff too. Like if you eat like a good breakfast, you're gonna want to go to the gym later on. And if you eat like shitty Taco Bell at night, you're going to want to sleep in till 10 o'clock the next day. So
that is a good point about the mornings. I think that's like your key time to get momentum for the rest of the day. Like if I wake up and within the first 30 minutes start like looking at notes, if it's like a day of like full on studying, like that day will be much more productive than if I allow myself.
You through the day,
gets you focused. So
all right, you guys want to get into
Placebros?
Ooh, little
name drop. Can we edit like placebo effect?
So we, I guess, are doing like, we have all these ideas for different segments for the podcast, and this one is called Placebros. I guess, Artem, do you want to explain a little bit?
If you're up in like the literature of like current like interventions for PT,
deep in the literature,
deep diving in the literature,
deep sea diving,
you'll notice that
new segment.
a lot of common interventions that you see in the clinic are actually placebos according to the research. I think that's hilarious because like you'll see PTs like so invested in like certain modalities, ultrasound, E-stim, whatever, manual therapy.
Especially older therapists because they haven't been in school and like
they've
just been doing what they've been doing.
That's true, and the emotional attachment.
They think that it has like some sort of like actual biomechanical or like mechanical effect on the body where like the research shows that it's like neurophysiological or placebo effects. And that just kind of makes me laugh, and I figure we'd cover, every week we'd cover either modality or intervention that has been deemed a placebo in the literature.
I mean, and again, like, so this article we chose, Artem found, it's called Placebo Mechanisms of Manual Therapy, a Sheep in Wolf's Clothing. Are you able to find this for like free?
It might be open
text?
access. I got it on Clinical Athlete. If you Google it, you can probably. If you can't find it, email us or something. Contact us and comment on YouTube, and we'll give it to you.
We've got Joel Bielowski. Sorry if I'm mispronouncing that, Joel. Mark Bishop and Charles Penza. They knew this was going to be on this episode, so they're all on the edge of their seat.
And Danny Bolger, too.
Oh, no. It's a story for another day. So this article I thought was pretty interesting. I mean, number one point just to make is that I don't know that it's necessarily even a bad thing that you're getting placebo effects.
Placebo's not a bad thing.
That's one of the things they talk about.
That's what it comes down to.
Yeah.
I mean, if that's what's allowing you to see progress in your patient, like that's a neurophysiological effect again. But it doesn't mean at the same time though that you can get like, I feel like it's a balancing act where like a lot of people fall on like a seesaw where it's like they put so much trust into this intervention that they don't want to hear anything about other effects that could be giving the benefit.
You're getting a placebo effect with any treatment, even if it is like there's an actual like physiological effect of the treatment. You can enhance the effect with placebo. So placebo is not bad.
So that was one of the first points they even made too in the article, is like, we're not saying it's like means the intervention has no, value in terms of a plan of care.
Sometimes placebo's even better. Like the example they used, placebo surgery, which is insane to me. Like people get cut open and they just don't do anything and then just fix them back up and it's like, oh, my back pain's gone.
Yeah.
Like that to me is insane. Well, obviously I'm not going to do that. I'm not going to perform surgery, but that to me is insane. Like that they have patients that they'll cut open, do nothing. It's a placebo surgery. They get better, but it's like you really just had to cut them open to like perform that. So placebo is definitely, honestly, sometimes it's like the best thing for people.
Super powerful. The only thing with it is you could also have the opposite effect of a placebo. Like there's good effects, but there's also bad effects called nocebos. So like it all depends it all depends on the therapist and how they communicate with the patient. So like you could have a good placebo effect, but like you don't have to scare the patient. Like say you tell them that you're going to do manual therapy because their rib is out of place or like their spine is subluxed. That's creating a nocebo effect because now they think their spine's out of place. When in reality, like you don't know that, you can't tell that.
Talking is placebo,
right?
Like just being able to educate the patient is placebo. Therapeutic alliance.
So just like it's fine to use placebo as long as you're not you're not lying to the patient. You're not telling them like this manual therapy is gonna put their bone back into place or something and
heal their open.
It's
fracture.
not,
Yeah. Well, and I think it goes back to one of the strengths we have as physical therapists, which is the amount of time we get to spend with patients and really being able to like get value out of that side of the communication and interaction of a treatment session, is like those things that are more of a like neurophysiological type thing, or a communication thing, or a confidence thing. We can really like use those to our benefit, whereas some other health practitioners may not. So that's kind of where we have a individual strength as a profession, and we should be able to kind of key into that and work on those skills. I think those are skills that I'd say a lot of people lack. Is how to communicate, how to get the confidence of a patient, how to project confidence yourself, and those types of things that provide even further benefits to the outcome of treatment.
Absolutely. So. And they kind of go over like that here, like how to, like what can enhance like the placebo effect, where they call it the ritual of like manual therapy, where like, especially like if someone is like highly touted as like this big manual therapist, like they're gonna have a bigger placebo effect if they have like this crazy ritual where they're like palpating every segment and like closing their eyes and doing all this weird stuff. It makes you think. Yeah, it makes you think that like they might know more than someone else. So that might enhance. It might not be like the most efficacious, but
everything. The facility, the machines they use, the bigger the machine, the newer, the cleaner, everything.
Yeah.
But I mean, like you said, as the first point, and it comes down to it, placebo works. You might as well.
Yeah. So this paper just talks about like the pain relieving aspect of manual therapy, and how like they call placebo analgesia. So like they're not necessarily saying like the biomechanical like effects of manual therapy or placebo. So like if you get enhancement range of motion, that might be an actual physiological effect, but like the pain relieving aspect of it is more so placebo.
Which is what we do.
Yeah.
Symptom reproduction.
Yeah.
Pain.
Yeah.
Cool.
Yeah, I guess like the last point would be also, it doesn't mean, I think it was touched on by one of you guys, but even if a treatment does work, it doesn't mean that like 100% of it is just the physiological or biomechanical change, or 100% the placebo. It could be a balance. So you might be, actually producing some change through your manual technique, but maybe that's 60% and the other 40% is placebo. So just having that understanding and that appreciation to then, have a further understanding of really what you're doing with your patients.
And that's seen with modalities, I think, like perfectly. Like hot pack, obviously you're heating something. Are you heating the muscle to really relax it? I don't know, but you're heating something, and you're most of the time relieving pain. So it's 50-50 or like 60-40. I don't know what it is, but
as long as you don't tell the patient it's going to fix their problem, then you're kind of just lying.
Yeah, I guess it goes back too to the whole like, I mean, you have your academic side of what we're doing, and you want to be, based in research and with what you're doing, but also the results of what you're getting. I mean, you have to, at the end of the day, you're in charge of providing a service to a patient that you're treating to the best of your ability, and so that they get better from when they first walked in the door to see you on that first day. So I think whatever produces that should have some, respect, and you should have some, belief in that. That part. And then you can determine sort of why those things were, and to what extent it was this, and to what extent it was actually this being what worked. So
because then otherwise we're just people doing placebo stuff.
Exactly, and there'd never be any progression. I mean, there'd never be any, because we might not know right now why something works, but in 10 years we'll understand. So
So by the head author, Bilowski, actually has a paper, I think it's fairly recent. It's called The Mechanisms of Manual Therapy. It's like 30 pages long if you look it up. I haven't gotten into it yet.
That was another thing. When I saw this was 4 pages, I was like, all right, that'll work. Yeah. But anything over 10, dude, fuck that. For at least until this semester.
Yeah, I pulled it up as like 30 pages.
Full disclaimer, I did not read this article. I wanted to be as authentic as possible, so like I do with every other article, skimmed it, was looking for an abstract. There is no fucking abstract.
Well, the whole thing is basically an abstract.
Yeah, so, it's not like a real like random controlled study. It's like It's just like a
Yeah.
overview of a bunch, but
Right. Yeah. KP's got other business to attend to as class president, El Presidente.
I'll just read my jokes and our questions.
All right, yeah, so, okay, let's get started with our last segment, which is listener questions. So we've got
you guys had a lot of great questions.
Yeah, a lot of great questions.
So many,
Keep submitting, submit.
Please, Will.
Overwhelming amount of, stuff coming in from listeners, just positive feedback, questions. So we're going to take a few and give our answers.
Yeah, I'm excited to what you guys got. All right, so Ben Dover from Dover, Delaware says, what's the most critical thing a CI has taught you or something you learned outside of school that has helped you as a student?
That is a good question,
What's
Benjamin.
the most critical a CI has
Thanks,
taught
Benjamin.
us?
Or something that you learned outside of school, whether it's a research article or before school, even that you haven't learned in school, but it's helped you become a better student.
Not necessarily like a particular thing, but what my CI allowed me to do. It's like my last summer CI, gave me a ton of independence, and he was just kind of after the first few weeks, he got a vibe from what I knew, and how I could take care of patients, and he kind of just let me do my thing and watch from afar, and that just gave me a lot of confidence in my skills and working with people, and that kind of carried through to school with practicals and stuff. I'm if I could work with if I could eval, treat, and create plans of care for actual patients, this is going to be easy. These aren't even real patients for our practicals, so I think that made it a lot easier for me.
Yeah, I think just going off with some of the conversation from today even, I would say my CI this year in the fall from our part-time clinical, he was just sort of a really good model and example of really what we look for, I think, and kind of what we were talking about not only using evidence-based interventions, but being able to explain that to the patients, and also being able to have a really good sort of just feel for what needs to be done with patients. I think he really meshed well all of those aspects, and really came across as someone who knew what he was talking about, really cared about the patient's well-being, but was also very much up to date with research and his interventions and continuing ed. And he did this one thing with rotator cuff patient when he was doing passive range with them. It was a neuro stretch technique, and he got into the tendon and provided input into the tendon, the Golgi tendon organ or the muscle spindle, and kind of to put another type of neurological input into the system so the muscle would relax, and it you could see the benefit in terms of her range.
That's the mechanism of foam roller.
Yeah, maybe. I mean, he was doing passive.
That could be a segment.
Passive range while he was doing it.
Yeah,
talking neuro. That would last.
We don't have much to say.
I have to have some resources with us for that to go on.
And that was talking neuro.
Yeah, that was it. All right, KP, thanks. Well, I
guys.
guess we have another
Two
question or
PTs
two.
in a pod?
Two PTs in a pod now.
So KP's actually getting fired after this. He can't do that. Well, actually, do you have any questions?
Behind the scenes.
Yeah. Okay,
Yeah, we
KP,
should.
you might want to stick around for this one real quick.
Me?
So, Chad from Chattanooga. Wow.
Chad.
What a place to live. He said, hey guys, I just wanted to get your opinion on auscultation technique. Big cardio pulm guys.
Oh yeah, huge.
I often find that I can't get good middle lobe breath sounds on large-breasted women. Wow, really going for it, Chad. And was hoping you guys could offer some practical advice on how to overcome this. That's a good question, Chad.
It's a great
Great
question,
question.
Chad.
That's a tough one for all of us, I feel
Um,
like. It's being men in this industry.
Yeah.
It
Just
gets
practice
kinda
on
awkward.
Artem. He's a
Gets kinda
large-breasted man.
It's kind of awkward.
You could have him lift his breast tissue.
Well,
up
that's what I was
Yeah.
going for, as one of our cardio pulm teachers told us.
Yeah.
Just ask them to move
Who
their
are both
breast tissue.
females, by the way.
Both
So it
females,
was coming from experts,
Yeah.
not only in the field but in the gender too. So, yeah, I'm gonna let you guys tackle that.
Alright.
Yeah.
If we put if we put a serious spin on it, I think that's it's just you get more comfortable the more patients you work with. I mean, I can't say that I've ever dealt with at this point needing to do a auscultation on a large-breasted woman where I've needed to to do that, but I think that's that strategy, again, it comes like how you present yourself is how the patient is going to respond. So if you're calm and
don't be awkward.
Yeah, do not fucking
don't
be awkward. That might be hard for some people. But yeah,
act like you've been there before.
Yeah, exactly.
Even if you haven't.
Exactly. Exactly. Yes, a patient looks at you as a clinician and someone who's there to be the expert. Like, act like an expert. Act like it's we've been taught the proper way to go about these things and how to be professional in certain uncomfortable circumstances. So you just have to make sure you exude that professionalism and confidence when you're going about it.
Don't tell patients this is your first time doing something. Rookie mistake.
Yeah, like that. Do not go for the fucking sympathy card. That is like a pet peeve of mine. Like, you're gonna make mistakes. Just fucking own that and but do it in a confident manner and
absolutely.
You're gonna get better.
Extreme ownership. If you haven't read Extreme Ownership,
another
understand.
Plug for Extreme Ownership for sure. Thanks, Chad.
Thanks, Chad from Chattanooga. It was a great question. Hopefully you got more.
We got one more.
Well, this one I think could honestly be its own episode, so I can introduce the question.
Maybe a preview for
tackle
next week.
It for next week. So James from Philadelphia asks, "What's up, guys? I was wondering if you guys could lay out a framework for how you would treat a non-traumatic orthopedic injury." So the three of us probably have fairly similar frameworks, but we could talk about that next week and kind of lay it out.
Sounds good.
Word.
All right. I guess that's it for this week. Episode 2 in the books. Stay tuned for episode 3 next week.
Yep. Hit us up with your questions.
Yeah. Do we want to go over that? At whatever, Instagram?
We'll put it down below.
Yeah. Put it down
Follow
below.
us.
Yeah.
All right.
All right. See ya.